Hi, I'm Michael Meloy, longtime resident here in Warrensburg, Missouri. Moved here in 1989 to come to college and never left. I've opened a business up here over the years and work in the insurance and financial services industry. I started feeling really pretty bad, a lot of abdominal pain, a lot of pain that wasn't going away. And I told my wife, okay, pain's really bad, but I don't want to get the kids up. I'm going to drive myself to the emergency room. And I remember driving myself to I don't recommend that by the way for anybody, but I drove myself to the emergency room and walked through the front door of the emergency room, and I was so grateful that they were able to get me in so quickly. But the pain absolutely was the worst pain I've ever experienced. Abdominal pain right in the middle of my stomach, my chest, kind of. I didn't know what was going on until probably several hours later. I didn't know that I had pancreatitis and a very severe episode of pancreatitis. Still don't exactly know what brought that on, but it was definitely the worst thing I've probably ever experienced in my entire life. I wish I would have listened to my body maybe a little bit sooner. I would have gotten help a little bit more, but had a really great experience through the emergency room. I can't say enough things about the nurses and the doctors and everybody that was in that staff. The level of care is outstanding.
We care about our patients and their health, and we recognize at Western Missouri Medical Center, in emergency situations, time is critical. So 2 years ago, we looked at the community and we wanted to provide answers as to why are we having longer wait times. We wanted to be able to help out the patients and answer those questions. So we developed what was called the ED Improvement Committee. At that committee, we were able to look at quality, wait times, and figure out what can we do best to improve this process for our patients. We were actually able to reduce our wait times by 50%, making our average wait time around 20 minutes. So we worked extremely hard to be able to provide higher quality care here closer to home without having to go to the big city. We were able to have a level 3 STEMI, stroke, and trauma certification here at this facility.
So I walked in the front door and immediately told the lady that was checking me in what was going on. And it wasn't within about 5-6 minutes. In fact, we weren't even done with the paperwork yet, and a nurse had came out to get ready to take me back. The people are local folks that live here, that work here, their kids go to school here, they spend their money here, they support our community. And I feel like that it's really important for us to support them as well. How cool is it that when you are living in a small town like Warrensburg, Missouri, that you have the opportunity to run into your surgeon, or you run into the nurses in the emergency room, or wherever it might be, the people that take care of you. That doesn't happen in big city hospitals, it doesn't happen in big cities, but it does happen in Warrensburg, Missouri, and it happens in Western Missouri Medical Center. My name is Michael Meloy, and Western Missouri Medical Center is my partner for life's emergencies.